As an investigator enrolling subjects into the pharmacokinetic study of ceftaroline fosamil avibactam, or CXL, in subjects with augmented renal clearance, it may be a challenge to recruit subjects into a trial using a study drug with no direct therapeutic benefits. We hope this training video will help optimize your time with these critically ill subjects or their legally authorized representative. The aim of this video is to effectively and quickly cover the study's main risks and possible benefits, and to successfully address concerns or obstacles to enrollment while complying with research regulations. Once you identify a potential subject who appears to meet the key study criteria, you will need to approach the subject or the legally authorized representative. Given the critical care setting and the accompanying emotional atmosphere, it is important that your approach is short, to the point, creates a level of trust immediately, and is not overly clinical. Here is where a compassionate and interactive bedside manner comes into play. Even if this is already your natural approach, it's all the more crucial in a study with no direct therapeutic benefits, as your approach will help to determine if a subject decides to enroll into this study. Before approaching the subject, it is often beneficial to understand who the caregiver or LAR may be. Whatever information you can gather from the nursing team ahead of time may prove helpful. For example, it can be useful to ask the nursing staff questions such as, what is the LAR's relationship to the potential subject? Or, does the LAR have any perceived attitudes about participation in a clinical research study? Which family members are present? What are those family members like? How do they feel about the subject participating in a clinical study? Are the family members optimistic about the subject's recovery? The answers to these questions will reveal important information that will indicate how you may want to proceed. Depending upon the responses and the overall mood of the family, you will be able to gauge whether you should be more brief and direct, or if a warm and compassionate approach is more appropriate. Regardless of your technique, escorting the LAR to a quiet place to have these discussions may minimize potential distractions. To start the conversation with the subject or the LAR, you may ask if during this distressing time they would consider helping other people who may also need antibiotic treatment. You may suggest that the given subject could be an ideal candidate for an important study. Please keep in mind that the critical care setting or the circumstances surrounding the hospitalization may prevent some from fully processing what is happening or why you're speaking to them. During the discussion with the subject or LAR, you may need to explain systemic inflammatory response syndrome or how augmented renal clearance affects drug elimination in general ways to help the subject or LAR understand why they are being approached for the study. Some statements that may be helpful are, we are inviting you or the person under your care to take part in a research study for seriously ill people who need antibiotics, but whose overactive kidneys may too quickly eliminate medicine chosen to treat their infection. The study should tell us if the overactive kidneys leave too low an amount of a test antibiotic compound in the body. The one-time test compound infusion is carefully given over 1 hour, followed by 9 blood samples taken in approximately 2 teaspoon amounts over the next 12 hours. The patient will then be carefully observed for the next 24 to 36 hours. Highlighting the basics of the study is important, and delivering those points in a general yet informed and empathetic manner may help the subject or LAR consider the study opportunity more closely. Even if the study has no direct therapeutic benefit to the subject, there can be benefits to society as a whole if the subject consents to participation in this study. There are avenues of discussion to cover with the subject or LAR without making promises, guarantees, insinuations, or other suggestions that would be inappropriate. Some talking points regarding these wider potential benefits are: the antibiotic pipeline has largely dried up due to microbial resistance, and there are few new antibiotic compounds becoming available in the near future. It is important that we test the drug in the intensive care patient population with augmented renal clearance to determine if the drug should be given in higher amounts. Although there is no direct benefit to you, your participation will help us understand how the drug will behave in future patients with similar potentially life-threatening infections. As a participant in this study, Your health will be monitored by both the research team as well as the usual medical staff. Additionally, the PI or study staff should highlight the short duration of the study. This study is a single-dose study, and exposure to the study drug will be limited to a single 1-hour infusion only. The infusion and the study blood sampling will be done through a tube in your arm or hand that may already be in place, thus reducing the discomfort and the number of additional study procedures for each subject. The total amount of blood taken will have minimal overall effect on the patient and be only about 7 tablespoons worth. The total time on the study is 3 days. Lastly, the PI can highlight the relative ease of the study. The study staff can give the drug and sample the blood through a tube in your arm or hand that may already be in place. The catheter used to collect urine may already be in place. There is no extra effort required on the part of the subject, as the research team will do everything required for the study. There is no cost to the subject for study-related treatments, exams, or tests. The subject or LAR may also find it interesting or motivating to take part in a study that may advance science. You may mention the subject would be part of a group of hard-to-find patients and that there are already other subjects enrolled in the study. An additional consideration to make with the subject or LAR may be the following. If screening shows you could enter the study, you have the opportunity to personally volunteer your hospital time to possibly help others like you get the best antibiotic treatment available in the future. As the conversation moves along, it will be important to inform the subject or LAR that the study drugs have already been used in other individuals. This may help to relieve any feeling that the subject is taking part in a radical experiment or is merely a guinea pig. It may be useful to mention that ceftaroline in itself has a well-understood safety profile that is similar to other commonly used antibiotics in this drug class. There are no worse side effects nor increased incidence. It is currently an FDA-approved medication, and that the dose of ceftaroline used in this study is the same as the suggested dose of ceftaroline for non-critically ill patients. Some previous study data may be helpful during these discussions. You may mention the following. One component of the antibiotic compound is ceftaroline fosamil, with the registered brand name of Teflaro. It was approved for use in the U.S. by the FDA in 2010 to treat major skin and lung infections. It has been studied in over 3,000 other people. The other component of the antibiotic compound is avibactam, which works in combination with Teflaro to make Teflaro active in the body for a longer length of time and thus kill more bacteria. Although not yet approved, the combination of Teflaro with avibactam has been studied in over 200 people. If any new findings about the study drug are learned during the course of the study that may affect your willingness to participate, someone from the study team will tell you about them in a timely manner. During the exchange, it will be important to transition to the informed consent process. The subject, or LAR, needs to know that whatever topics have been discussed are only the basics, and that there are additional details to be found in the informed consent form. The various rules and regulations are completely covered in the informed consent form. As you already know, the ICF must be properly administered in its entirety before any study procedures are done. Refer to your institutional guidelines and practices for more information. And remember, you and your staff cannot promise any therapeutic benefit from participation in this research study. With the proper information and technique, you may bypass the various study obstacles to enrollment. And please remember the following suggestions. Consult with the subject's nursing team to determine if the best method of approaching the subject or LAR is to be more direct or more empathetic. Explain the condition, study, and scientific components in general, understandable terms. Highlight the short duration as well as relative ease of the study. Be sure to mention that the compounds have been previously tested in other subjects. Always maintain your institutional guidelines and best practices during all recruitment activities. Thank you for your time and good luck with your enrollment efforts.